welcome back to Live Well with Dr. Mel. I'm Dr. Mel, licensed physical therapist and holistic health coach. If you haven't yet subscribed to my channel, go ahead and click that subscribe button. You'll get access to all my free physical therapy tips and tricks. In this video, we're going to go through ischial bursitis. After watching this video, you're going to have a better understanding of how to prevent this from occurring, as well as how you can treat it and manage your symptoms now. If you're ready, let's get started. So if you're in the acute phase of ischial bursitis, you may have a lot of pain and tightness in the back of your thigh. So you want to make sure you are icing regularly. You can even go into an ice bath for 3 to 5 minutes and take anti-inflammatories to reduce the pain and symptoms. Following that, you can also grab a tennis ball for the first exercise, and if you have a chair that's deep or a sofa that's deep, or you can do this on a bed, you want to sit all the way back with your feet dangling. From there, you're going to start with the tennis ball down at your knee and then allow the thigh to rest over the tennis ball with your foot dangling. From here, you may notice some tenderness by your knee. You can massage the tennis ball back and forth, left and right, working through that tight tissue. Spend some time there and then bring the tennis ball a little higher up, and you find a new spot, massaging back and forth. And you're going to do this technique all the way up the thigh. So keep working the tennis ball higher and higher up the thigh. Same thing, rotating and dangling the foot left and right, massaging the tennis ball along the posterior thigh. You may notice that one part of the thigh is more tense than the other. It may be all the way up towards the ischial tuberosity, or it may be closer down towards the knee. Wherever that is for you, place that tennis ball on that spot and then press it down through the top of the thigh to get a little bit deeper into that area of point tenderness. Go as deep as you can tolerate. You don't want to over irritate yourself, but you want to feel it and get a good pressure through it. And then from there, you can even kick and extend the leg out to get even more of a massage through that point. And you just hold for 3 to 5 seconds and then release and repeat. And you can repeat this about 10 times, and the ball is going to put some pressure into that point and help release the tightness in the back of that hamstring. Excellent. Very important to loosen up that tissue before proceeding to the next exercise. So the next exercise is going to help lengthen that hamstring, because it's so important to gain flexibility in the hamstring muscle, because the hamstring is connected at the ischial tuberosity, and when that's tight, it can lead to bursitis and inflammation in that area. So all you'll need is a chair for this exercise. You're going to place the bottom of your heel of the involved leg on the chair. Press the heel away, flex the ankle towards you, pointing the toes towards you. Squeeze the top of your thigh for 5 seconds, releasing the back of the hamstring, pressing the tailbone away. Hold for 5 seconds and then release. And then you're going to repeat that again, and you're going to do it for 10 times. So squeeze the thigh, press the heel away, flex the ankle towards you, press the tailbone away to lengthen the entire hamstring on the posterior thigh. And release. And repeat. Squeeze, 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 lengthening the space between the knee and the ischial tuberosity, releasing that hamstring. Good job. So make sure you do that for at least 10 times. If it's still feels tight, you can do it even longer, and then proceed to the next exercise once it feels a little looser. So we also want to stretch the muscles surrounding the hip, the piriformis muscle and the external rotators of the hips as well. So you can lay down onto your back, and you're gonna cross your involved ankle onto the uninvolved thigh. So if it's your right leg that has pain, you're gonna put the right ankle on the left thigh. Press the knee away, and you should get a nice stretch in the outside of your hip here. If you're still not getting a stretch and you want to get a deeper stretch, you can thread your hands around the other thigh and pull the left thigh in towards you, getting a deeper stretch on the outside of that right hip. And for this stretch, you just want to hold. You want to relax and hold for at least 30 seconds here. This is going to loosen all your external rotators, loosen all the outside of your hip muscles, because that can also contribute to bursitis if the hip muscles are tight. It's always beneficial to do these exercises on both sides. So go ahead and hold for 30 seconds on the right, and then you can repeat it on the left as well, and then proceed to the next exercise. It's a glute stretch. So what you're gonna do is grab the front of the shin. If you can't grab the front of the shin, you can also grab behind the thigh, and then you're gonna pull the knee in towards your chest, getting a deep stretch in your butt muscle here. You're gonna hold this for 30 seconds. With every exhale, you can pull that knee a little closer to your chest, getting a deeper stretch. And make sure you do it on the other side as well. So my recommendation would be to perform those exercises 2 to 3 times a day. If you're still having pain and symptoms, it's always helpful to seek professional help from your doctor or your physical therapist. Well, I really hope this helps. I'll see you next time.